A good diet prevents memory loss. Dietary interventions to prevent dementia or cognitive decline are generally safe, readily available. It can be easier to implement than interventions such as exercise. But evidence supporting these interventions varies. Perhaps the best one is the Mediterranean diet. This is high in grains, vegetables, fruit, potatoes, nuts, seeds, legumes, fish, and olive oil, and low in red meat, poultry, dairy, and alcohol. The dietary approach to stop hypertension diet is similar, but is higher in low-fat dairy and lower in fish. The Mediterranean intervention for neurodegenerative delay or MIND diet incorporates elements of both these diets, but places more emphasis on berries, nuts, and beans. A meta-analysis of prospective cohort studies show that people who adhere to a Mediterranean diet have lower rates of Alzheimer disease and Parkinson disease. Similarly, studies of community-dwelling older people who followed the MIND diet showed less decline in global episodic, semantic, and working memory and in perceptual speed, perceptual organization at 4.7-year follow-up. In addition, the participants were less likely to have developed Alzheimer disease at 4.5-year follow-up. Data from some randomized clinical trials support the use of these diets to prevent cognitive decline and dementia. In the PEDM study, participants 55 years of age at high risk for cardiovascular disease were randomly assigned to one of three diets: a Mediterranean diet with supplemental extra virgin olive oil, a Mediterranean diet with supplemental mixed nuts, or a regular diet that emphasized reduced dietary fat. There was a reduction in the composite of myocardial infarction, stroke, and death from cardiovascular causes with the supplemented Mediterranean diets. A secondary analysis demonstrated higher scores on the mini mental state examination at 6.5 years. He had better psychomotor speed at 4-month follow-up. This body of evidence is suggestive of the benefit of a healthy diet on cognition and dementia. Diet can also be effective when it is part of a multi-component intervention. The dietary component included fruit and vegetables, whole grain cereal products, low-fat milk and meat products, low sugar, margarine instead of butter, and at least 2 portions of fish per week. During the 24-month follow-up period, the neuropsychological test score was 25% higher and executive functioning and processing speed were better in the intervention group. This body of evidence is suggestive of, but not conclusive for, the benefit of a healthy diet on cognition and dementia, coupled with other benefits related to hypertension and cardiovascular disease. Clinicians should consider recommending these diets for appropriate older people. Thank you.